So, very good afternoon to all of you. And thank you, Professor Shomik, for introducing me and for giving me the opportunity to talk with the public health professionals, and particularly in the webinar, which is on careers in public health management. And I'm really delighted to be part of this particular webinar. I'll be very happy to share my journey of public health experience while working in different departments, different organizations in India, outside India. And I know that the time given is, and intentionally I did not, prepare any formal slides. So I thought of, sharing my thoughts extempore. And as you know that, I've been asked to talk about the importance of public health management in government and non-government sector, and with special emphasis on why there is a need for a public health management cadre or a kind of people. What is the need? And then if we understand the need, then obviously the second question which comes to our mind is what kind of skills are required to be a successful public health professional? And then thirdly, you will also like to know that if you have acquired those skills, where are the opportunities? I think in terms of opportunities, Dr. Mavlankar has touched upon various areas, but maybe I'll also try to add with my experience some more opportunities. Now, in terms of the need of a public health management, I think that is the big question, which we need to understand and need to, answer that question, why there is a need. As you're all aware that improving health is one of the topmost priority of India and even globally also. And you also must be aware that there are number of commitments at the global level, and something which you might have heard about is the sustainable development goal, that the government of India made commitments that they'll be able to achieve. There is a goal 3 which is called healthy living for everyone. And looking at those global commitments, because health is so important, the government of India also brought out, and it continues to bring out, a kind of a national health policy statements. And there is a big document, which is also a document which is developed by the Ministry of Health, owned by the government, which also makes, several commitments. So that means across the country, globally, there are commitments. Within India, there are commitments. And some of those commitments are so ambitious. Like one of the commitment which I would like to mention is there is a commitment to reduce the premature deaths due to non-communicable disease by 33%. I think how many people may be knowing that 5 million people die every year because of non-communicable disease, hypertension, coronary artery diseases, and around 1 million people even die of 0.8 lakh, 0.8 million. They also die of cancer every year. And beside that, you also must be aware that around 1 million children, under 5 children, die every year. Around 500,000 injuries and accidents happen, and these deaths happen. And then the 1 million deaths are also attributed to the air pollution. All these problems are so huge. That's why there are dedicated targets have been kept to make a reduction in the prevalence of those diseases, so that we can make our population healthy and we can make our country economically strong. As you must be aware that health, development, and the social and economic of the country depend on the health of the population. Now, if there are so much of commitments and there is a huge problem, and as you know, the size of India with the 1.4 billion population, 6 states, and there are more than 7 The average population of a district is around 1.5 to 2 million. So literally speaking, and there are many countries in the world where the size of the country is 1.5 to 2 million. So roughly you can say whenever we talk about health in the context of India, it is like managing, 700 countries at one go. The kind of the hugeness which is there. And that's why looking at this hugeness, the size of the population, the burden of the disease, the kind of the global commitments, the policy commitments we have, the kind of the approach which government of India has adopted, and even the globally which is being talked about, is something which is called as the universal health coverage. You can only achieve ambitious target by following the simple approach of comprehensive primary health care, providing universal health coverage. And there is a lot of emphasis nowadays on health system, strengthening, because health system strengthening is the approach, which needs to be followed if you need to achieve those big ambitious target of reducing premature death due to NCD, reducing child mortality, maternal mortality, eliminating eliminating tuberculosis, eliminating neglected tropical diseases, reducing the load of malaria. And beside that, you also must be aware that in India, around 60 million people go into poverty every year because there is a lot of out of pocket expenditure. I don't know how many people are aware that out of the total health expenditure which the family pays, 67% is out of pocket expenditure. And you can understand that 67% is a huge percentage of contribution which people have to contribute. That's why in the universal health coverage, the concept is that we must ensure the provision of the essential basic package of services with quality, irrespective of the cost. We should be able to provide to each and every citizen of the country without putting a financial burden. So that's why universal health coverage is a three-dimensional approach. It talks about reaching everyone. It talks about basic package of services with quality, and it also talks about the reducing out-of-pocket expenditure. So this is the kind of the approach which has to be adopted. And then if these approach of health system strengthening, universal health coverage has to be adopted, the kind of the basic in mind, and these basic the principles are in terms of understanding the overall the epidemiology of these public health problems. What is the burden of the disease? You have to understand the human resource for health available to manage all these things. You have to understand the supply chain issues. You have to understand the monitoring and evaluation components. So if the health has to be addressed holistically, keeping in mind the agenda of the universal health coverage, the whole health has to be managed like a real health manager. And that manager is called as the public health manager. Now, when we talk about the need of the public health management in the government sector, we do understand, but you must also be aware that in India, the private sector plays a major role. More than 70% of the OPD care is provided by the private sector in India. More than 40% of the inpatient care in India is provided by the private sector. So unless we take the private sector along, we will not be able to achieve our committed goals of universal health coverage or sustainable development goal. So that means in private sector also, there is a need for a solid, high quality public health program management capabilities. And you also must be aware that we have in India a complete reform has happened in the public health system, and district is the unit for planning and action. And then at the regional part, we have the sub centers are there, which are now being converted into, and they are being now renamed as the health and wellness centers across the country. That means people are going to have the primary health care near to the homes of the people, and that is the health and wellness centers. And then we also has a big element of service which is called as the communitization, and that is the community participation. And we also have a dedicated health worker at the community level for every village in the country, and which is called as the ASHA workers. You must have heard about, accredited social health activist. Now, as on today, we have around 1 million ASHA workers across the country. Now, if the whole health has to be provided, we have to make best use of the available manpower. We have to make best use of the available knowledge in the area of supply chain. We have to have the best expertise in the area of understanding the disease burden, continuous program monitoring, continuous program evaluations. Only then you should be able to achieve your goals. You need to do a mid-course correction. You need to do some kind of a economic analysis of a particular intervention. Your cost effective, cost benefit analysis has to be done. If these ultimate the targets which have been set by government of India or by the global community, they can only be achieved if we address all those so-called the simple management principles, which talks about situation analysis, which talks about epidemiology, which talks about surveillance, talks about supply chains, human resource for health, and even the financial. All these skills are important. Now, in order to support this health system, there's a strong need for a qualified public health professional who can support the government as well as the non-government sector. And the second question was, what kind of skills will be required? Now, the kind of the skills which are required, that you should be able to understand the demography. How the populations are changing, how populations are moving. Like we say that maybe 10 years back or 20 years back, the population above 60 years of age was, let's say, 4%. Today, the population in India above 60 years of age is roughly around 8 to 10%. Those population dynamics are changing. People are living longer. The average life expectancy at birth 20 years back used to be around 50 years of age. Now today the average life expectancy in India is 67 years. Those are those demographic dynamics we have to, as a public health professional, we have to understand. Things like urbanization. We have created a big health system, primary health care system in the rural areas, and people are moving from rural areas to urban areas. Migration is a big issue, big challenge. The cities are getting converted into slums. That's why if you look at this present COVID scenario, if we would have a solid primary healthcare system, solid public healthcare system, the crisis would not have been so much. Because the urban healthcare system, we have not been able to explore, we have not been able to develop. There are efforts in that direction, but you as a public health continue to forewarn, continue to make projections that how the population dynamics are changing frequently. So urbanization was the another area of importance. Aging population is another area of importance which we have to be considerate as a public health professional. And then understanding the disease epidemiology, because we as a public health professional believe in preventing diseases, promoting health, and obviously preventing diseases, promoting health is cheaper than treating patients or managing so many patients. If large number of tuberculosis patients cases can be reduced, we can reduce the load on the hospital. If we can manage large number of non-communicable disease right at the earliest, we should be able to reduce large number of unnecessary surgical interventions which happen if people follow all simple lifestyle kind of diseases. As hypertension, obesity, diabetics, it is getting a huge problem. 10 to 20% of the population is suffering from hypertension, diabetes, and most of these things are preventable, and they can be managed by a simple public health and preventive and promotive actions. So understanding disease epidemiology is crucial, and particularly like in this COVID environment, this COVID pandemic, understanding that community disease transmission, how it is happening. It is happening by close contacts. That's why people are talking about keeping a safe distance of 6 meters, keeping distance, and then repeated hand washing, using masks, possible by understanding the disease epidemiology. And then obviously the skills like surveillance skills. Surveillance is nothing but continuous monitoring the situation, and there are golden principles of monitoring disease events, and surveillance skills is a really very critical in this era of pandemic. And then, as you may be aware, that large number of data sets are being collected for variety of programs. So unless you have a skill of data management and data analysis, you may not be a successful public health professional. And also its analysis and its use and monitoring evaluation, rapid assessments technologies, and then something around advocacy and the communication skills. This is also one of the critical area which as a public health professional you must understand. I know that there is a dedicated science of communication, but as a public health professional you have to get some skill of communication. And that's why I say that the few skills which a successful public health professional must have is you should have the skill of documentation, high quality documentation. Because you as a public health professional do not get the opportunity to interact with the patient. You are sitting in your rooms, and then you are making public health decisions. You are making public health opinions. So your documentation skill should be of a highest quality. You should also have a good skill of communicating, doing an advocacy with the leaders, advocacy with the policymakers, and even doing an advocacy with the community. So you should have that kind of a skill, and obviously the skill of data management, which is called as the typical data management, the analytical skill. And then last but not the least, things like networking. Public health cannot be practiced just by alone. You have to engage many players, you have to engage many stakeholders, and it has to have a real skill of art of networking with various stakeholders and the professionals. So these are the kind of the skills, to my experience, we must hone, we must have to be a successful public health professional. And the last part, which I'll take maybe another 3 minutes, in terms of variety of opportunities. I think opportunities are huge. You have understood the need, you have understood the quantum, the commitments, global, national commitments. So the opportunities are huge. Now, opportunities like, there is a big national programs across the country. At least in India, we have national programs. It could be a tuberculosis program. It could be a non-communicable disease program. It could be a mother and child health program. It's a universal immunization program, leprosy program, malaria program. We need people of these skills who have a public health expertise, public health skill, who understand the concept and who can deliver, public health, approaches nicely. And then you also must be aware, beside the health department, there is also a dedicated program by the Ministry of Women and Child Development, which is called the Poshan Abhiyan, where there is a lot of kind of ambitious target to address the problem of malnutrition, and then Ayushman Bharat. Now, beside that, I have also seen these public health professionals. They also get the opportunity of being as a public health officer in the municipalities or as a district public health officers. And they, if they have done public health qualification, and I know many of these states, they have made it mandatory. If you have to be a district public officer, you should have public health qualifications. States like Gujarat, states like Tamil Nadu, states like Odisha, I think they have made it mandatory. Now, beside working in these various programs at the district level, there is also an opportunity which also Mavlankar also mentioned in terms of international organizations, UN organizations, and there are a number of NGOs which are working, which are supporting the government of India in implementing these programs using the science of public health, using the skills of public health, and they need public health professional to support the government of India in facilitating the implementation of the various programs. And then we have a number of public health institutes who are involved in training, research, and evaluation, like Public Health Institute of India, Indian Institute of Public Health. And then there are research organizations, there are even private companies who also hire public health professionals, and there are a number of academic institutions. And even frankly speaking, there are many countries in the world who also hire public health professionals, beside WHO, UNICEF, UNDP, and so many other international organizations. I happen to serve in a country, small country, which is name is the Sultanate of Oman. They have recognized the importance of public health professional, and they continue to recruit people as a public health professional to be a epidemiologist in some geographical area. So I was working as a regional epidemiologist in Sultanate of Oman, and even Abu Dhabi, Saudi Arabia, they also continue to seek these kind of people with these kind of expertise. So with these few words, so I think I have been able to convey the need. I have been able to convey the kind of the skills required and the variety of opportunities which are available to be a successful public health professional. So with these few words, I again thank the Indian Institute of Public Health, Dr. Swami, Dr. Mavlankar, Dr. Zodpe, for giving me this opportunity to share my thoughts. And I intentionally did not prepare this time. Thank you very much.